Welcome everyone to the NIOSH Total Worker Health webinar series, Smart Work Design for Healthy and Productive Work. So free continuing education credits are available for this presentation through the CDC's Training and Continuing Education online system. We are pleased to be able to offer the following continuing education types: CME, AAPA, CME, CNE, CPE, CEU, CECH, AAPSP, RACE, and CPH. Detailed instructions on accessing the Training and Continuing Education Office site are available for download at the website at the top of your screen, tceols.cdc.gov. Note that the bright blue activity number is only valid for those watching the live webinar. You'll need the course access code to receive credit. We are also recording this webinar and plan to post on the Total Worker Health webinar page as soon as possible for those who couldn't join us today. And I'd also like to welcome today's featured presenter, Dr. Sharon K. Parker. ARC Laureate Fellow Sharon K. Parker is a John Curtin Distinguished Professor at Curtin University, Director of the Center for Transformative Work Design at Curtin University, a Fellow of the Australian Academy of Social Science, and in 2019, she was named among the world's most influential scientists and social scientists in the Web of Science highly cited researchers list. She is a past associate editor for Academy of Management Annals and Journal of Applied Psychology, and has published more than 200 articles in leading journals on topics including work design, proactive behavior, and job performance. We are so happy to have her with us today. Welcome, Dr. Parker. One quick note before we get started. Next slide, please. For anyone who has not joined one of our webinars before or is new to the concept of total worker health, a quick note. Total worker health is defined as policies, programs, and practices that integrate protection from work-related safety and health hazards with promotion of injury and illness prevention efforts to advance worker well-being. It is a strategy and approach integrating protection and prevention. It combines the mandate of safety and health protection with the opportunity of advancing worker well-being. So with that, I will go ahead and pass it over to Dr. Parker to begin her presentation. Thank you.
Thank you so much, Sarah, and good morning to everybody. It's a terrific privilege to be talking with you this morning about a topic very dear to my heart, which is work design. I'd like to begin by acknowledging the traditional owners of the land on which I am today, which is the land of the Whadjuk people here in Perth, Western Australia, and I pay my respects to elders past, present and emerging. And that is something we do in Australia customarily before any presentation or meeting, which is to acknowledge the traditional owners. So with that, I'd like to move on now to talk a little bit more about work design. I lead a center called the Center for Transformative Work Design, and you can see the website there. And we are primarily a research center, but with a very strong emphasis on translation and impact. And I'll come back a little bit to talk a little bit more about that towards the end of my presentation. But before we get started, I want to introduce you to Jeremy. This is Jeremy here. Jeremy is the manager of a rubbish dump. Now, I think you might call it, I don't know what you might call it, a trash tip maybe, but anyway, he manages a place where all the rubbish, the trash ends up. And as you can see from that picture there, he actually loves his job. He rates it as 9 out of 10. So this is sort of intriguing. So he does what's considered, some people describe it as dirty work, work that has perhaps a little bit of a moral taint. That's the definition of dirty work. But he absolutely loves his job. So how could that be? So I want to share with you a little bit more about Jeremy and his work design a little bit later. But the significance of him is that he's somebody that I met where I go on holidays every year, which is near the coast. And I was intrigued by Jeremy because, as I say, he manages this rubbish dump, but he loves his work. And part of the reason he takes an enormous amount of pride in his work, and he's actually recycled a lot of the rubbish to create beautiful artworks that he's very proud of. And what you can see there on the left is our artist in residence who is sketching Jeremy and his work. And this was an idea I came up with when I got some funding, some significant funding to look at work design in more depth. How do we convey what work design is? And we came up with the idea, and it was inspired by Jeremy, of actually sketching people in their work as we interview them. And you'll see as I go through my presentation this morning, some of the sketches that are materialized out of this project. So what is work design? Well, this is a sort of, I hate to say it, but it's a pretty boring academic definition, but let's get it out of the way. It's the content and the organizing of tasks, activities, relationships, and responsibilities within a job or role, or a set of jobs and roles. So it could be work design at a group or team level, but it's fundamentally about who does what, who makes decisions, what tasks people have, and their responsibilities, and so on in work. But I guess one of the things that's important about work design is it tends to be a little bit neglected as a really important strategy for improving health in work, but also performance and other outcomes. The way that I see it, I like to use this sort of iceberg metaphor, I suppose, that we sometimes see stress in organizations, but the temptation or the tendency perhaps of managers is to send people off for counselling if they're stressed, so EAP, employee advisory, or if people are not performing well, tend to send people off for training, or if innovation is lacking, we do things like we have fun zones and things like this. But I guess what I'm going to really strongly argue today is that often the real cause of stress or poor performance or lack of innovation is often really about the work design. And therefore, we're not going to solve it through some of those other strategies. What we need to try to do is really get to the root cause of some of these symptoms. And that leads us to a focus on looking at how work is designed and structured. And that's something that people have been doing for more than 100 years. I wrote a review not too long ago of 100 years of research on work design. So there's a lot of research on this topic. And in fact, that's what can make it sometimes a bit tricky to implement. What you can see there listed is, I think there's about 20, 25 different work characteristics there that have been studied and shown to be important. And so when it comes to designing work for people, there can be this, well, it's a bit overwhelming for managers. Well, where do we start? What's important? And so on. And because of this, my colleague and I have created what we call the S.M.A.R.T model of work design. And effectively, sort of from a statistical perspective, we've done a higher order factor analysis, which is really just a sort of fancy way to cluster similar things together statistically. And so I'm going to go through the model briefly, but then I'm going to unpack it in a little bit more detail. So first, there's a group of work characteristics that we call stimulating. So this is about work where there's some variety, where you use your skills, where you've got some meaning in your work, perhaps there's some challenging problems, and you're dealing with information and other aspects that make the job sort of interesting. The second component is mastery. And this is really about this fundamental idea that most people who go to work want to do their job well. But to do so, they need to know what is their job, what is their role. They need to have clarity about what it is they do. They need to get a bit of feedback on how they're going. And it actually also helps if they're doing a whole job so they can see where their work fits in the broader picture. So that's what mastery is about. A is for agency, and that is about autonomy or human agency. We used to call it autonomy, but I come from Western Australia where we do a lot of mining and there are a lot of autonomous machines. So I've had a few confusing conversations where I'm talking about human autonomy and other people are talking about machine autonomy. And so for that reason, we moved now to calling it agency, and I mean human agency. The fourth component is relational, and this speaks to the fact that, you know, humans have a fundamental need for connection and belonging. And so we need to design work that is relational. And then T, I'd like to call the big one. And what I mean by that is in a lot of workplaces, this is the big concern for many professionals and others in work, is how do we get demands that are tolerable? So here the idea is that all work has demands. They might be cognitive, so thinking sorts of demands. They might be emotional demands, emotional pressure. They might be time-based demands, so working for long hours, etc. Or physical demands. Whatever the demands are, they need to be tolerable for people. So they need to be at a level that people can manage and deal with them sufficiently. So this is the S.M.A.R.T model in a nutshell, and effectively it's a model that is summarizing the core aspects of work that we know psychologically are important for people. Just those of you who, and many of you will be, I'm sure, coming at this from the perspective of psychosocial hazards or psychosocial risks or work stressors that you need to deal with. And in many countries, it's a legislative requirement to make sure that there are not psychosocial risks in work that cause harm. This model maps onto those, and you can see that there. I'm not going to talk through it in detail, but the point is, I guess, that we tend to focus on creating good work, positive work, but it's the same as removing risks and hazards. It's just different framing, but it's the same basic ideas. So why does work design matter? And I've already mentioned that these aspects of work can be considered psychosocial risks. So inevitably, therefore, if you're creating smarter work for people, you're going to boost people's mental health and well-being. So that's a primary, and indeed, many of these attributes actually influence physical health as well. And I can give some examples of that later. But what we also know from research, it isn't just about mental health and well-being. Actually, there's a very big evidence base that if you have these attributes of work that I've just talked about, it's going to create work that's more motivating, engaging, and that is going to foster performance, and particularly things like innovation and creativity that require a little bit more sort of motivation, I guess, from people. And then also there's a huge evidence base that having these aspects of work is important from a learning and a growth perspective. So if you want to facilitate or accelerate even development and so on, then these sorts of attributes are important. So I'm going to just go through a little bit more detail now on each of those elements. So let's start with stimulating. And as I mentioned already, this is about work where you have variety. So you're not doing the same thing over and over again. You've got challenge in your work. You're using your skills. And you're not just using your skills, you've got the opportunity to develop your skills. So here you see in this picture, hospital supply workers, and you can see them saying things like, you know, there's never a dull moment. I like the variety, or this job teaches me a lot. So they are referring to having work that is stimulating for them. And in contrast, you can see this sketch of a Uber Eats or Deliveroo person who is actually complaining about the lack of stimulation in his work, saying it's boring. There's just so much time waiting. So if you have work that is unstimulating, What are some of the consequences? Well, of course, it means individuals are disengaged. There is a phenomenon increasingly people are talking about called bore out. So we know about burnout, but bore out is really that acute level of boredom. And I like to share at this point a example of a French person who actually sued his organization because he turned up every day and he did about an hour of work. He worked in a French perfumery, and that was it. He had nothing else to do, but he had to stay there because that was the requirement of the job. And he talked about how it was really a descent into hell. And he actually was successful in suit. This was a few years ago, so successful in his legal case, and actually was awarded 40,000 plus euros for being excessively bored at work, because it actually did cause him psychological harm. You can see also, though, that physical injuries, physical aspects like musculoskeletal injuries, if you're doing the same repetitive movements over and over again, because the job is boring and repetitive and just doing one thing, then those sorts of negative physical aspects can occur. Another consequence can be that lack of growth and lack of development. From an organizational perspective, though, if you don't give people stimulating work, again, we see negative consequences of disengagement, turnover, absenteeism, poorer performance. A lot of evidence that if you look at return to work after injury, if people are coming back to an unstimulating, boring job, they're much slower to return to work, much less likely to return to work as well. The waste of talent one, though, is I want to give an example. Many years ago, I did my PhD actually in manufacturing companies in the UK. And one of the things that always struck me was in an organization that introduced self-managing teams, they really talked about how one of the main positive consequences of self-managing teams was that they discovered that they had stars on the shop floor. So when people were working in very monotonous and unstimulating work, people just the managers and things did not see that actually they had a talented workforce. But when they gave them a bit of autonomy and variety and opportunity to grow, they really discovered what had been previously untapped talent. So I think this is a really important negative implication of lack of stimulating work if you don't create it. Let's turn now to mastery. And so mastery, to remind you, is work where you are clear about what your goals and your responsibilities are. So role clarity is a component of mastery, where you get feedback so you know how you're going and you understand where your job fits in the bigger picture. And you can see here an aged care assistant talking about some examples of, if you get some regular appraisals, it helps you to improve. It's great if you get some feedback if you did well. Or sometimes when you feel tired, you get emails or stars to tell you thanks and you feel appreciated. Actually, we're doing a lot of research in the aged care sector ourselves. And a lack of role clarity is one of the most important stresses that we're coming across, in particular because people feel pulled in many different directions and they don't know which is the most important thing to prioritize. And that can create a lot of ambiguity and a lack of mastery. What are the consequences of that? From an individual perspective, poor mental health is a significant outcome. And you can see I refer there to a meta-analysis, which is, of course, an analysis of many studies. So a meta-analysis of 33 studies, more than 19,000 people, that links this lack of role clarity, so not knowing what your roles and responsibilities are, to depression. And you can see that burnout is also an outcome of low mastery work. Also things like job dissatisfaction and turnover. And for organizations, of course, things like poor performance. If people don't know what they're meant to be doing, they're not likely to perform very effectively, and they're likely to be a bit inefficient and not very agile. Just to give an example of this and this is a study that I have done with colleagues. So this was a case where surgical teams were coming together for to carry out the list of surgeries for the day, and often they would turn up and they wouldn't even really know each other's names. They often had not worked with each other before. And so one of the real issues was a lack of role clarity. So the nurses would turn up and they wouldn't know who was going to take on which role. And so there was just sort of, they wouldn't know necessarily the order of the patients. So this was a very simple intervention. It was a 5-minute multi-professional briefing before the day, before the surgical list. And it would involve the anaesthetists, the surgeons, the technicians, and the nurses. And they would literally just spend 5 minutes. They would do a little bit of planning. This is what the operations are. They get to know each other just a little bit. And we were really trying to encourage voice because, in fact, as you would probably know, most of the accidents, most of the errors that occur in surgery occur through a lack of communication across professional boundaries. So that was the intervention. And we measured that intervention. Actually, I had a PhD student do a PhD project on it. And you can see that the surgeon, the anaesthetist, the nurse, all the different groups found value in this intervention. So the surgeon says, I feel unhappy if I haven't done a briefing before the beginning of the list. It's a bit like getting into a car and not putting a seatbelt on. You just don't feel safe. You feel like something is missing. And you can see the anaesthetist is talking about how it creates a really positive environment, and the nurse also saying that it really makes a massive difference to how the day runs. We systematically measured that the levels of engagement. Staff became more engaged after this intervention. There was a 50% reduction in delays, and that occurred because people actually planned things, and instead of discovering, oh, wow, the next operation needs this particular piece of equipment and we don't have it and it's going to take 30 minutes to track it down, they actually planned. And so the delays were significantly reduced, which had a huge cost impact, as you can imagine. But also we measured things like safety communication. I had a PhD student who did more than 350 hours of observation of surgeries, to the extent that they were pretty much asking him to help with the surgery. At the end, he became so familiar with the processes. But in the end, this is an example of how you can intervene to enhance that mastery and get some of those benefits that I indicated before. Going on now to agency, and as I said before, this is really autonomy, but it's autonomy over when, how, and where you do your work, and also having the opportunity to influence decisions that shape your day-to-day work operations. So what you see here is an academic. And those of you who know anything at all about academics, you know that that autonomy is very precious to us. But this is an academic who the university has been centralized. So a lot of the decision making has been taken away from the sort of local academics, and the academics saying, what I want in my next job, so this academic's basically leaving, is a unit with some autonomy to make some decisions. And he also says every new thing that's centralized is another blow to innovation. And this is, in fact, one of the real downsides of not having agency in work, is that you take away ownership and you reduce things like innovation and creativity because of that. Of course, from an organizational perspective, taking away agency is also important for things like performance and innovation. There's a lot of evidence that, if you want to stress someone out, give them a lot of demands and take away take away their autonomy. So there's a lot of evidence that a lack of control and autonomy is predictive of burnout, those sorts of outcomes, those sorts of mental health outcomes. So moving now to R. R is about the relational component of work. And I mentioned how important social connection is. Well, we can design work to have more social connection or less social connection. We can design work to ensure that there's support for people, and we can design work so that people know that their work is having an impact on other people's lives. That's some of the work that Adam Grant has done in the past few decades. So here's a childcare worker sitting in a sandpit talking about how it's actually quite a stressful job, is what the person's saying, but actually being part of a team is so important component of good work design. Whereas in contrast, you see here, this is a dancer actually, and you can't necessarily read all those small things there, but she's talking about how effectively, you know, she gets put down a lot for the way that she looks, and really does not get that support at all. In fact, probably the reverse, and how distressing that is for her. I guess we learnt about the importance of relational aspects of work during COVID, because many people had to work from home. And whilst many people loved aspects of that, it also did create isolation and loneliness and disconnection from people. You can see, of course, negative effects for individuals that I've mentioned there, but also for organisations if there's a lack of relational aspects in work. For example, workers' compensation cases in Australia, and I'm pretty sure, I don't know if it's true in the US, I'd be curious to know, but the fastest growing category of workers' compensation claims are psychological injury. And then within that, the two biggest factors are job pressure or job demands, and that's the T that I'm coming to in just a minute. But the other one is bullying and harassment sorts of behaviours. So very, very negative, of course, for people. Just to give an example, we've been looking at hybrid work, and we actually measured the quality of people's work, their SMART work design when they were in the office, but we also separately measured the quality of people's work or their SMART work design when they were working from home. And one of the interesting things that we found, which we published in the Sloan Management Review article, is that it was only having support from colleagues in the office that protected against feelings of loneliness. So if you had management support in the office, that didn't change your loneliness. If you had colleague support at home, so you're working at home, but you felt supported, but that didn't really change your loneliness. It was good for your job satisfaction and things, but it didn't impact on your loneliness. So it seemed from our research like there was something quite unique about the support that you actually get from being in the office. So, you know, maybe as we design hybrid work, we need to, or remote work, we need to recognize that there may be some benefit of some time in the office. And if I move now to T, the big one, as I call it, the importance of having demands that are tolerable. So you can see here on the left, this is actually a geneticist whose job it is to diagnose rare diseases. And he's talking about the biggest challenge is having enough time. So the time pressure can be a demand for people. And on the right, you see some surgeons talking about the emotional demands in the work. Most people don't realize that surgeons see things and deal with difficult situations, like when someone is terminally ill. That creates emotional pressure on people. And there are other demands also. They can be physical, they can be cognitive, they can just be very, very long working hours, for example. Of course, the big demands are one of the biggest drivers of poor mental health in the workplace, burnout, stress, anxiety, depression, even cardiovascular disease. There is some links. Medication use, there's a big study showing more demands, more change demands in organizations. So constant change was predictive of more medication use. So some risks for individuals, but also, of course, risks for organizations, things like not just absenteeism, but presenteeism. So turning up when you're sick, because you've got such big workload, you don't want to stay home because you just have more work when you come to work the next day, and those sorts of outcomes as well. I just show there on the left, this probably doesn't mean so much to you guys, but in Australia, we do have shark attacks occasionally. But what you can actually see is that suicide from work pressure is a far greater cause of death than shark attacks, but it doesn't get anywhere near the attention. I guess that's the point that I'm really trying to make there. There is some evidence. It's not in every single case, but there is some evidence that if you've got those resources of the S.M.A.R., it can help to make the demands more tolerable. So if you imagine we've got people with moderate to high demands, so let's imagine something like police work or harassment, police harassment, police work or paramedic work or something like that that's, got high demands. But you've got that high demands, but then you've got no support. You've got no agency to deal with those demands. That is going to be quite stressful. Whereas if you've got those high demands, but you've got support, you've got a boss that cares, you've got some agency over how you're going to handle those demands, or give yourself a little break if you're feeling exhausted or whatever, then that can really offset those negative effects of the demands and make them more tolerable. So it's important to look at the S.M.A.R.T model, I guess, holistically. And that's just one example of how those elements can work together. So that's the model. How can you use the model practically? So I guess in a sense, one of the most important ways the model can be used, and we're using it a lot in this way in Australia, is to improve mental health and well-being in the workplace from a prevention perspective. Because, of course, if people are struggling psychologically in the workplace or burnt out, there's, a temptation to send people off for counselling, etc., which is fine because because they need that help. But what's causing the stress, and if that is the things under the iceberg, the work design, then we've got to address the work design. So it's a way to prevent poor mental health in the workplace. I haven't talked so much about how those components can affect physical health and safety, but if I had more time, I could. There is evidence for them. Things like quiet quitting and the great resignation I mentioned earlier, that motivation is an outcome of these aspects of work design. So it can also address those sorts of components. It can be a way to develop more effective leaders. Leaders who create smart work design will be more effective. It can be a way to improve hybrid work and working from home, which I know has been a struggle for many organizations, figuring out, I have a lot of conversations with managers where they say, how many days should people be allowed to work from home? And really, that's not the right question. It's really more about how can you maximize the quality of work, whether it is working from home or working in the office. And for example, if you give people complete agency, but they never come into the office and they might miss out on the R. So you can use this model to create more holistic models or more balanced models, I guess, of working in a hybrid way. Also, I've written a lot about this. If anyone is interested, let me know. As we have more AI and automation and other sorts of digital technologies, there are pros of these technologies, but we also risk some really negative effects. And the model can be used to make sure that we design technology and implement technology in a way that is healthy for workers. How do we then go about doing that? This is sort of really a topic for another presentation. It's not something we can fit in a couple of minutes. But of course, when we're talking about work design, it is a multi-level, multi-stakeholder approach. So I have this SMART change strategies model, which, as I said, I won't go into detail because we don't have time. But we're talking about, we can think about work design at the individual level. What are individuals doing? And that sometimes we talk about this notion of crafting, how individuals can craft their own work, but we can also look at changing work at the team level. We can look at changing work design at the organizational level, so flexible work practices or other HR or an occupational health and safety strategies can all influence work design. And then, of course, we can even go higher actually and look at occupations, and we can even go higher and look at nations and regulatory frameworks and so on. And all of those shape work design. So there's many paths to good work design. There's no single strategy. What really is often important is involving the workers. So again, we have a model called the PATH model, which I won't talk through due to lack of time, but the fundamental thing is if you are trying to create better work design for people, most of the time it's really important to do that in a highly participatory way. So involving the people who do the job in the process of redesign itself. So those are sort of just two very broad points, and happy to take questions a bit more on the change side. Also just want to point out that we have plenty of resources and information if anyone wants to take it further. First of all, on the research side, our website, transformativeworkdesign.com. We have, just to give some examples, I mentioned we're doing a lot of work in the care sector. So we have a project called S.M.A.R.T Designed for Care, where we are conducting work redesigns. So we are changing the work to make it smarter and then systematically tracking the impact of those changes. We're doing a lot of work on the future of work, automation and so on, and how we can create healthy work from that point of view using the SMART model. And also, if anyone is interested in population aging and the fact that we have an aging workforce, which really means we have to think about work design from that perspective as well. So how do we use work design to accommodate changes over the lifespan? We have a whole bunch of research on that topic, plus more. But we also are super keen, as I mentioned right at the outset, to influence practice. So we have two websites that you can see there, smartworkdesign.com.au and thriveatwork.org.au, where we have lots of free tools, cases and other resources that are available. We also run workshops, and we are actually developing a train the trainer model that will be coming up soon. And we also have lots of practical articles. So just to quickly share, that might be, we just published one in Sloan Management Review, where we look at how ChatGPT can actually be used to create better work design. So that is an interesting one to look out for. And I did just want to do a little bit of an advertisement. I know that we are a really long way here in Perth. Probably can't go much further for many of you, but we have a work design conference coming up in February, and we are going to have virtual recordings of that conference. So anyone who's interested in work design, you might want to jump onto our transformativeworkdesign.com website and register for the conference, and you can get the virtual recordings. We have all of the best work design researchers, not all of them, but several of them coming to Perth. So I just want to wrap up really by returning back to Jeremy. So I mentioned that Jeremy, said that this was his best job ever. He gave it 9 out of 10 on a scale. So let's just unpack. So in terms of stimulating, Jeremy really felt that his job was really meaningful. He said, I like to do my bit for the planet, because he saw his job not just as dealing with rubbish, but as recycling that rubbish. So he'd actually organized all the old bikes into a little pile so that people who wanted spare parts for their bikes and things could come and use them. So he really was doing his bit for the planet. From a mastery perspective, he said the locals, so the people who live nearby, he said, they let me know how it's going. So he gets feedback from people about the work that he is doing. From an agency perspective, he had a lot of autonomy in his job. He says, I have freedom. And he said, it's up to me how I do things. And, it's partly why he was able to create the beautiful artwork and things, because he had that autonomy. Interestingly, for a rubbish dump, which is, you guys don't know this, but it was sort of out in the middle of nowhere, out in the coast, quite isolated place. He says this place is a social hub because all the locals would go there and chat to him and so on. So he actually got a lot of connection in his work. And then finally, he actually had quite a bit of free time in his work. So it was very tolerable work for him. And this helps to explain why he saw his job as the best ever job. But I also just want to point out that from that outcome perspective, it was also generating great outcomes. And this is a picture actually of those little piles of different sort of recycled materials that he created. And one of the people who went, one of the locals said, well, the tip used to be revolting with all the rubbish just in one big pit with plastic and other stuff getting blown into the nearby bush. But it's 100% better now. So also the work was generating those performance outcomes, I guess, that I indicated can arise when work is well designed. So that is it from me. I hope some of you are still on there listening to me. And thank you very much. And I'm very happy to have some questions. Please connect with me on LinkedIn if you ever want to see some of the papers that I usually put up there. And I think I'm going to hand you over to Sarah now. And thank you very much.
Thank you so much, Dr. Parker. Yes, so we will go ahead and jump into the Q&A. If anyone has any questions, please submit them through the Q&A box. But we do already have a couple, so I'll go ahead and ask you. So first question, can you comment on the possibility of agency becoming a risk factor when there becomes too much of it, such as in high performance work systems when line workers may actually be required to exercise high levels of decision making?
Yeah, it's a really important question. I actually have a PhD student who did their thesis on the curvilinear effects of autonomy, which is basically, and the idea was that, that a moderate level might be best. And there is some evidence, and actually she did a meta-analysis. So she did an analysis of studies that had looked at these curvilinear effects and concluded that there is a curvilinear effect. It was the shape of the effect, you might not be able to see me drawing it mentally, but it sort of went up and then plateaued. So it wasn't necessarily that more autonomy was bad, although some studies did find a little bit of a drop. It was more that you don't get more benefit. And some of the explanations for that, are things like when people get overwhelmed with choice, it can actually, create inefficiencies too. So I think that's an excellent question, that too much autonomy is not always a good thing. Having said that, in my experience working with organizations over many years, it's fairly rare that I see too much autonomy. I much more see the issue at the other end of the scale, where there's micromanagement, bureaucracy, etc. So I think, yes, it can be an issue, but most of the time I actually see the problem is at the other end. I hope that makes sense.
Yes, definitely. Thank you. So what would you say if I asked how supervisors could increase task identity or scale task variety, but maintain that role clarity?
Yeah, and this is why, I say it's a holistic model, because, if you try to, they all interrelate. And Of course, if you make work incredibly complex, it can be a little bit more confusing and ambiguous, which means that lower mastery. So, it's like actually all of these components. It's like my grandmother used to say, everything in moderation, Sharon. It's sort of like, you know, looking for some variety. But I guess another thought that's going through my mind is, what sort of clarity is important? What tends to be more important is clarity about where you're going, not necessarily the detail of how to get there. So if people are clear, this is where we're trying to go, this is our goals. So goal clarity is actually sometimes more important than having all of the means to get to the goal tightly specified. So I think people can cope with variety and challenge and that stimulating aspect if they know where they're going. So I think focusing on what are the end goals that we're trying to achieve here is probably more important than trying to pin down every tiny little step, because actually pinning down every tiny little step to getting there is going to undermine agency as well. So yeah, so it's a tricky one. But look, I also think talk to your workforce and be guided by them too. If you're not sure, if you think that you're giving people variety, but you might be confusing them, just talk to them and ask them. And most of the time people are more than happy to and actually just introducing this model can be a language that people can use to sort of say, well, yeah, no, I'm actually fine on the stimulating, but, now you've actually made my work so stimulating, it's become intolerable. So giving them the language can actually create an opportunity just to check in on how they're doing.
Wonderful. Thank you. Okay, let's see. Next question. Can you share what issues are on your research horizon? What are the work design challenges of the future?
Yeah, that's great. And I guess that's where I do come to the future work component. So I guess there's two really big ones. One is, I would say, is AI and automation. And AI and automation have got release incredible opportunities. Remote surgery, you can have people operating from thousands of miles. But what we also see, though, is that they can create risks for workers too. So as an example, we've done a project recently with train drivers whose jobs were automated. So prior to the automation, they drove trains. They loved driving trains. They actually describe themselves as koala bears because they're so rare and special, right? So that's the way they describe themselves. But since their jobs have been automated, they describe themselves as Band-Aids. I'm not sure what the American word is, probably plasters or something, but the things that you put on sores. In other words, they feel that their work, all of their skills have been taken away. Their job now is to watch a screen and to identify when the train breaks down, which is fairly rare. And then when it breaks down, they call technical people to go and get it. So their job has gone from what they saw as a highly skilled job using lots of tacit knowledge to monitoring a screen. I'm not saying that that's going to happen in all cases, but there are risks of automation and AI. We wrote a paper recently on algorithmic management. So algorithmic management is when you have rules and machines and algorithms making task allocation decisions. Think Uber driver, they have algorithms, they don't have managers. But our review, which was a review of more than 40 studies on the use of algorithms in work, showed that most of the time it makes work more intense and the demands become more intolerable and the agency becomes lower. So that's another risk. So that's one big thing that we're really focusing on. The other one I would say is population aging. I know that America has an aging work population. So one of the things we really need to do is say, well, as people age, their physical abilities change, their their preferences change, their lifestyle change. They might want to look after grandchildren, or they change. That's an inevitable consequence of aging. How do we accommodate that change? And one way we can do it is through creating better work design for people. So if, for example, we know that as people mature, they have more interest in mentoring and legacy. So maybe we need to create work designs where there's even more opportunity for sort of task significance and making a difference, or create work designs where the physical demands are lowered because physical changes have occurred. So that would be the other big area that we're working on. But thank you for that question. Appreciate it.
Yeah, thank you. Let's see. Okay. This question, bear with me, it's a little long. It says, hello, I like how you mentioned the connection between mental health and cardiovascular disease. Do you have any experience or thoughts on incorporating a psychosocial focus in a workplace health promotion program that is mainly targeting cardiovascular health of employees?
Yeah, that's really interesting because, I mean, I guess you'd want to understand to what extent are the drivers of the cardiovascular issues and the psychosocial the same. So, for example, if one of the drivers is excessively sitting, so you're just sitting around a lot, and so therefore you're putting on weight, and that's got cardiovascular repercussions. But if that excessive sitting is also stemming from the fact you have no autonomy over the ability to get up and walk around and take a break, so you've got a common cause there. You've got lack of autonomy driving too much sitting, which is causing cardiovascular disease, but you've also got it causing potentially mental health challenges and well-being challenges. So I think it would be important to understand, are there those common drivers? But we know, for example, that one of the risks that causes work risk that causes cardiovascular disease is lack of agency, is lack of control, because it's stressful when you don't have any control, and that creates cortisol and all those sort of consequences. But we also know that lack of control is mentally unhealthy for other reasons as well. So I think it would make sense to try to look at those things together. So it was a long question, but it was a really good one. Yeah, thank you.
Perfect, thank you. Okay, let's see. For older, you might have answered this in the last one. Tell me, for older workers, do you find that any one aspect of S.M.A.R.T is less important or more important?
Oh, that's a great question. Definitely one of the most important ones, and research shows this, is the agency. So there is some evidence that as workers get older, we call them mature workers in Australia, by the way, as we have more mature workers, then actually having autonomy becomes even more important. And there's a few reasons for that. I think it's partly sort of a preference, but it's also things like the demands around maybe caring for, you might have a partner that's aging, or you might have a grandchildren, or you might have parents even that are aging if you're 50 or whatever in the workplace. And so that more flexibility and autonomy is really important. So that's one of the most important ones. I think that there's a stereotype that mature workers don't necessarily want to keep learning. So sometimes that's and there's actually evidence to suggest, at least our research shows that, but that mature workers often report that they don't get development opportunities because I don't know, there's also, I think, sometimes a sense from employers it's not worth investing in them because they're old, but that is a stereotype actually, and mature workers are keen to continue learning. So I think I think probably most of the demands. Oh, I've got a clap for that. Thank you. So I think that the model probably still applies to. I can't think what's least important, at least not off the top of my head. But thank you for the question.
Okay, thank you. Okay, are you finding that the Karask demand control model of job stress continues to identify key concepts in this topic?
Yeah, so the Karasek demand control model. Yeah, and as the person who wrote that probably knows, that model has been extended to the job demand resources model. Which in a sense, the S.M.A.R.T model is like we have 4 resources and then the demands. So the S.M.A.R.T model is actually a sort of version of the job demand resources model. But one of the things that we found with the job demand resources model practically, so I'm talking practically here rather than research wise, is that there's a lot of demands and there's a lot of resources, and people still find it hard to say, oh, well, what's a resource and what are the most important? Whereas actually just saying, well, there's the stimulating, mastery, agency, and relational, it just unpacks it a little bit, makes it a little bit more manageable. So yes, it's definitely, demands and control they're in the model, it's the T, and the A is the, but I guess we just extended it slightly, but not quite as broad as the job demand resources model.
Okay, perfect. Thank you. Okay, one last question. This is just mine. I love the artist in residency's sketches. I thought they really sort of humanized, but also, I don't know, created a great picture of a person in a job. But I was wondering if you had a plan for them, or if there was a place
Ah,
where people could find them.
yeah. So if you go to our website, transformativeworkdesign.com, you can access them from there. And actually, so we sketched about 40 different occupations. But also one of the really cool things we did, and Sarah, I'm glad you mentioned this because I really do want to somehow publish these things one day, and I just haven't got around to it. But one of the really cool things we did was we also hosted a global sketching competition. So we actually also have on the website all of these sketches from people all around the world who mimicked the same format. So they interviewed someone and then sketched it. So I know, for example, that we have a butcher in Australia, we have a butcher in India, and we have a butcher from somewhere else. I can't remember. But it's absolutely fascinating to see the sketches from all over the world. So if you're interested in art, and there's even a sketch actually that one of the artists that submitted, we made it a competition, so you can see the winner and all that sort of thing. One of the artists who submitted, one of their children also submitted a sketch as well. So yeah. So look, it's been a really nice way to try and convey the importance of the topic, because you can sound a bit dry, I think, and that's what we were trying to do, was just make it come to life a little bit more with the sketches.
That's amazing. I will absolutely look at that. That's so cool. Okay, well, I think we're out of time. Sharon, if you can go to the next slide, I'll just
Oh, yes.
remind, oh, you're fine. I'll just remind everyone that there are many ways to connect with us. We have a website, cdc.gov/NIOSH/TWH. Here's our Twitter handle, or X now. And we also have a newsletter. So if you go to this link, it's cdc.gov/NIOSH/TWH/newsletter. You can subscribe, and we send out quarterly newsletters with updates from our program, our partners, and just about the topic and what's new. So feel free to subscribe there. But otherwise, thank you so much, Dr. Parker. For those unaware, it is now 11 p.m. for Dr. Parker. So we are very grateful for your time and for you staying up late for us to give this presentation. So I'll just thank you one more time and thank everyone for joining and participating and asking great questions. Please
Thank
just
you
join us.
so much. Oh,
Yeah,
thank
of
you. And
course.
those, I love the little claps, and thank you so much. That's feedback for me. That's improving my mastery. So thank you very much.
Of course. All right. Well, we'll go ahead and close out, but thank you all for joining.